So good evening everyone, this is Dr. Vineet Sehgal and today we would talk about the lacrimal gland and lacrimal drainage disorders. You can see all my lectures exclusively on the Unacademy Learning app. Unacademy Learning app, which is the best way to prepare for your NEET PG and FMG, has a plus subscription. In the plus subscription, you would have the daily live classes, there would be structured schedule of the classes, there would be live tests and quizzes, and there's unlimited access to the video lectures. Also, you can download the PDF of the video lecture that is taught by the best of the educators. If you want to go with the best preparation strategy, you can have an iconic subscription as well. In iconic subscription, not only you would have the live classes and the batch classes subscription, you would also have the added advantage of the prep ladder where the best of the faculty would have be teaching you with the video lectures, and there is the access to the question bank 2.0 with the rapid revision course. Also, there is a limited time offer where if you want to go with the iconic subscription, you can basically take it at never before rates. Remember, this is basically available for only those students who are basically subscribing first within 500. Also, if you want to go with a 3-month subscription, you can add a 1-month subscription totally free of cost. There are a lot of core batches which are going on. From 28th of April, there is the NEET PG Season 1 batch, and the FMG test analysis batch would also start from the 20th of April with the best of the educators. On the Unacademy Learning app, there are lots of questions. There are 34,000 questions which are carefully curated for the PG entrance exam. So start your preparation by downloading the Unacademy Learning app. If you want to basically test the free platform first, you can basically see a lot of special classes there. Myself, Dr. Vineet Sehgal, all my special classes are available to free of cost to all of you, and use my code OPHTHAL10 to unlock the platform. This same code would be useful for you if you basically go for the plus subscription or iconic subscription also. With this, I would be starting my session that would be on the lacrimal drainage disorders. So first of all, we would talk about the anatomy of the nasolacrimal system. If you can see this diagram, these are the two puncta. Okay, they are on the medial side of the eye. So if you can see this one, this is your eyelid, and here there are openings. So puncta are small openings which are there on the medial side, both on the upper and the lower puncta. Okay, on the upper and the lower lid. Basically, these upper and lower puncta, they open into these canals. They are called upper and lower canaliculi. So this is my upper canaliculi. I write it by upper C, and this is my lower canaliculi. This upper and lower canaliculi, they now join each other to form a common canaliculi, and this common canaliculi through the valve of Rosenmuller opens into the lacrimal sac. So lacrimal sac is basically situated in the lacrimal fossa. Sometimes they would ask you, what are the bones that form the lacrimal fossa? So the bones that form the lacrimal fossa, you should remember, they are the frontal process of maxilla, and the lacrimal bone. Okay, now they are basically bounded by two crests. These are the anterior and posterior lacrimal crests. This lacrimal sac then opens into the nasolacrimal duct, as you can see here, and this nasolacrimal duct through the valve of Hessner is finally opening into your inferior meatus of the nose. Okay, so can you appreciate that whenever we cry because of some emotional circumstances, sometimes we feel the taste of the tears in our throat. Why this is happening? Because of this nasolacrimal duct. Okay, now what is the direction of this nasolacrimal duct? Sometimes the question is asked about the direction of the nasolacrimal duct. Can anyone tell me? So you can just remember it with mnemonic double or badla. So it is downward, downward, backward, and laterally. Okay, so it is downward, backward, and laterally. This is your direction of nasolacrimal duct. Okay, now there are some of the causes which can cause the nasolacrimal duct injuries or the lacrimal system injuries. So what are the various causes of these lacrimal duct injuries or the lacrimal system injuries? The most common is some animal bite. Let's say there is a dog bite, or it can be due to violence. Okay, so let's say there is a domestic violence and you got hit by a blunt trauma. Sometimes it can be there after car accidents also, and sometimes it can be there after fractures also. Very rarely you may have these fractures or you may have the injuries of the nasolacrimal system after a endonasal procedure. So let's say you have some polypectomy done, and during the polypectomy you by chance injure your nasolacrimal duct. So these are the main causes of your nasolacrimal system injuries which are so important. Now we talk about the valves of this nasolacrimal system which is asked. So there are two valves. One is the valve of Rosenmuller and other is the valve of Hessner. So what is the function of the valve? Valve basically prevent the backflow of the tears. So all the time whenever our orbicularis contract, whenever there is a lacrimal pump working, the tears flow only in one direction from the puncta to the nasolacrimal duct. It is not that if the tears are accumulated in the nasolacrimal duct, they can go back in your canaliculi. So that is the main importance of these tears. As you can see, the valve of Rosenmuller, it is near the end of the common canaliculi. So it is at the end of, I write it as short form, common canaliculi, and its junction with lacrimal sac. This is my valve of Rosenmuller. If I talk about valve of Hessner is at the end of the nasolacrimal duct. It is at the end of the nasolacrimal duct and its junction with the inferior meatus. A commonly asked question. Okay, next. So next question sometimes they ask is, what is the main muscle that is responsible for this lacrimal pump? So the main muscle that is responsible for the lacrimal pump is your orbicularis muscle. And this orbicularis muscle is supplied by your seventh nerve. Another important question. Now, very important is that sometimes when there is a Bell's palsy, the lacrimal pump mechanism is basically disturbed because of the paralysis of the orbicularis muscle. So that's why in the Bell's palsy you may have the complaint of epiphora, because the tears that are formed, they are not getting drained. Okay, so from where these tears are formed, the main source of the tear production is your lacrimal gland. When I talk about the tear film, I would tell you the various components of the tear film and how they are formed. Just for the sake of this lecture, the tear film is there by basically made up of three layers: mucus, aqueous, and lipid. The aqueous lipid basically composes 90% of the tear film, and this aqueous component is basically formed by the lacrimal glands. So these lacrimal glands are of two types: main lacrimal glands and accessory lacrimal glands. I would talk about the main lacrimal gland today. the main lacrimal gland is there here, okay, here. So they are at the superior temporal point, okay. So these are your main lacrimal glands. If I basically divide the main lacrimal glands into two parts, it is the orbital part and the palpebral part. So something like this. You may be having a orbital part and a lower palpebral part. What is they basically composed of? So these lacrimal glands, the orbital part, it is basically like a badam, okay. It is like a almond. So it is a shape of almond, and it has a few lobules there, okay. So it is formed by few lobules, which is basically situated at the basically orbital plate of the frontal bone. So where it is situated? This area. So I call it at the orbital plate of frontal bone. This is the larger of the gland. The smaller one is the palpebral form. Okay, so the smaller one is the palpebral form, and it is basically posteriorly continuous with the orbital part. Okay, do not need to go too much detail, but remember that there are some ducts which basically go downward and then open into the superior fornix. Okay, so I just draw it like this. So these are my glands, and we have the ducts which are passing from this lacrimal gland, and they open into the superior fornices. So there are usually around 10 to 12 ducts. Okay. Okay. Then we have the accessory lacrimal glands. The accessory lacrimal glands are two types: the glands of Cross and the glands of Wolfram. So these glands of Cross and glands of Wolfram, they are basically present in the conjunctiva. Okay, so the glands of Cross are basically present beneath the palpebral conjunctiva, between the fornix and the tarsus, and the glands of Wolfram are present near the upper border of the tarsal plate. So you do not need to go into the too much of anatomy about the glands of Cross and Wolfram. Only you need to know is that the glands of Cross and Wolfram, they are the accessory lacrimal glands, and the main lacrimal glands are there, which is at the superior temporal part of the eyelid, at the your fossa of the lacrimal gland at the frontal bone. Okay, then you have to know about the blood supply of these lacrimal glands. So as the word suggests, the blood supply of the lacrimal gland is by lacrimal artery. Okay, when we come to the nerve supply is different for the sensory as well as the secretomotor. The sensory nerve supply is by the lacrimal nerve, and this lacrimal nerve is basically a branch of ophthalmic division of the trigeminal nerve. Then the sympathetic plexus which supply the lacrimal gland, it comes from the carotid plexus of cervical sympathetic chain. And the secretomotor fibers are basically derived from the superior cervical ganglion. So this is the point that you have to know regarding the nerve supply of the lacrimal gland. Okay, then if the patient is suffering from the watering of the eye, it can be because of the two reasons. Either there is an increased secretion of the tears, that is called hyperlacrimation, or if the tears which are secreted, they are not able to drain. This is the term that we use as epiphora. So there can be hyperlacrimation. It can be due to some reflex hyperlacrimation. Let's say you have got an injury to your cornea. If that is causing increased tears, there is a reflex hyperlacrimation. There is no component of any drainage disorder. If there is a component of drainage disorder, it comes into the category of epiphora. Now we would discuss the various causes and the various types of the nasolacrimal duct obstruction. So first of all, we talk about the congenital nasolacrimal duct obstruction. The congenital nasolacrimal duct obstruction, it basically happens because of the block of the valve of Hessner. I told you the valve of Hessner is there at the end of your nasolacrimal duct where it opens into the inferior meatus. So I just show you the diagram again. So this is the diagram. Here you are seeing the nasolacrimal duct. Here is my valve of Hessner. If the obstruction is at the level of valve of Hessner, then it is basically something which can open on itself. So if the patient is having a congenital nasolacrimal duct obstruction, most of the times these obstruction at the level of valve of Hessner, they open itself. What you have to do is you have to tell the patient to do a Krigler massage. What is the Krigler massage? It is like this. So this is the first treatment modality where you have to put your fingers here and from the medial part you go down up to the lateral side of the end of nose. This is basically called Krigler massage. What it does is it basically opens the nasolacrimal duct system. If the patient is not basically responding to this Krigler massage, then you have to go with the next option, which is called syringing and probing. So what I do is, first of all, I basically use this instrument. Okay, so if you can see in this instrument, there is a tip here. This instrument is called punctum dilator. So from the punctum dilator, what I do is I open the puncta, and after opening the puncta, I use this instrument. So if you can see, this is the probe. So this probe I basically use to, and this probe enters your canaliculi, upper and lower common lower canaliculi, goes into the common canaliculi up to the nasolacrimal sac. Okay, so this basically goes up to the lacrimal sac. So if there is a membrane or debris in the position of this in the distance of this nasolacrimal probe, then it can basically open with this probing itself. If this probing is not able to open the final constriction, then what we can do is that the last stages we can basically go with the surgery. The surgery which we do in the patients of congenital nasolacrimal duct obstruction, we usually do after 4 years of age. The reason is our facial bones are not fully formed before this. So we basically avoid doing this surgery in the patients if the patient is basically responding either to the Krigler massage or with the help of just syringing and probing. So the surgery that is done is called DCR. The word DCR means decryo cysto rhinostomy. So what I do is I make an alternate pathway from the lacrimal sac. I make an alternate pathway for the drainage of the tear directly into the middle meatus. So what I am doing is I am bypassing the nasolacrimal duct and directly opening into the middle meatus. This is the basic funda of a decryocystorhinostomy surgery. Okay. Now, decryocystorhinostomy is basically indicated in the congenital nasolacrimal duct obstruction when all the other causes are not working. Okay. Very, very important. So, what are the various tests through which we can tell that the patient is having a nasolacrimal duct obstruction? So the first thing that we can do is called syringing and probing. So what I do is I basically put this punctum dilator. With the punctum dilator, I open the opening of the puncta and then I put the probe. After putting the probe, I put a saline into my nasolacrimal system. If I can get a taste of saline, this means that the system is now patent. Okay. So what are the various interpretations of the nasolacrimal duct system, syringing and probing? So let's say if there is a block in the here and I have put the fluid from the upper canaliculi. I have the block also at the upper canaliculi. So what would happen is as soon as I put the saline, it would come back from the same puncta. Okay. So this means that there is a same canalicular block. Now the second situation is when we have the block at the region of common canaliculi. So what would happen is when we would push the saline, this saline would come back from the opposite puncta. Okay, this means that the patient is having the block at the level of common canaliculi. Now this would happen at very short interval after putting the saline. Okay, within few seconds you can get the water or the saline back from the opposite puncta. If the reflex is of mucoid discharge or if it is occurring after some time, then the chances are that you may be having block in the nasolacrimal system. Okay, so because what would happen is that first the fluid would accumulate here, and when the fluid would have already accumulated here, then it would come back from the opposite puncta. Okay, so this is the basically syringing and probing for the nasolacrimal duct system. The next test is called saccharine test. So what is happening in the saccharine test is that saccharine is something, a chemical which is very sweet in the taste. So what I do is I basically put a topical anesthesia over the eye, and after putting a topical anesthesia, I put a drop of saccharine. Okay, so here I have put a drop of saccharine, and if after some time the patient gets taste of this saccharine, this means that the nasolacrimal system is absolutely okay. But the reason is these patients may have so many times false negative test. Let's say if you have a problem in the taste buds, so patient would not have the your taste of your sweet taste in the mouth, but we would diagnose the patient as nasolacrimal duct obstruction, but actually the patient is not having nasolacrimal duct obstruction, he is having the problem in the taste buds. Okay, so that's why saccharine test is not very much basically used today. Nowadays a test which is used is the Jones test. So what happens in a Jones test is we put the fluorescein dye in the conjunctival sac. Okay, so and then we have put a cotton swab at the end of your nasolacrimal duct in your inferior meatus. So यहाँ पर हम एक cotton swab डाल देंगे और eye को stain कर देंगे sodium fluorescein से. So what happens is after 15 minutes, if this swab gets stained with the fluorescein, this means that the nasolacrimal system is patent. This is called Jones 1 test. So Jones 1 test basically tells that if the cotton swab which I have put in the nose, it gets wet with the sodium fluorescein, it gets the color of the sodium fluorescein, this means that nasolacrimal system is patent. If it does not, that means that it is not patent. Why it is not patent? Then we have to again do a test which is called Jones test 2. So what happens in a Jones test 2 is, what I do is I basically remove the fluorescein from my conjunctival sac, I wash it with the normal saline, and then through the puncta I push the saline into my nasolacrimal system. So with the pressure now, I am basically putting the saline inside my nasolacrimal system. So what happens is, after pushing it with the saline, with the pressure, if now there is a fluorescein which comes into the your swab which is there in the nose, so this means that there is a partial nasolacrimal duct obstruction which is basically getting corrected by the pressure which we give through the syringe of the normal saline. Even if after the pressure that I put, the swab is not getting stained, this means that there is a total nasolacrimal system blockage. Okay, so that is the basic advantage, that the type 2 Jones test can also tell you about whether it is a partial obstruction of the nasolacrimal duct or there is a complete obstruction of the nasolacrimal duct. Then, to basically see what is the cause of the nasolacrimal duct obstruction, the next thing what we can do is we can do a dacryocystography. In the dacryocystography, what we do is we basically take the posterior anterior and the lateral views of the lacrimal sac, and we use a water soluble dye which is called cintigraphy for the interpretation of the X-ray. So the interpretation can be different. So we take the films before putting the cintigraphy and after putting the cintigraphy, and we see the comparison. So the first interpretation is if we have the filling defects. So if there are the filling defects, it can be because of some internal masses like stones or internal tumors. Okay, remember, if there are stones they are more translucent in character. If there is a tumor, the tumor basically causes the deformation of the wall of the nasolacrimal sac or the nasolacrimal duct. If there is a polypoid proliferation, let's say there is a polypoid proliferation, then it basically shows you a lacy pattern on your dacryocystography. Sometimes there can be external tumors which are compressing the wall. So if the pattern has been seen where there is a wall compression, it can be some external tumor or the foreign body. Then sometimes nothing is there. Sometimes there is just functional blockage of the nasolacrimal system. To rule out this functional blockage, what we do is we do a test which is called nuclear cintigraphy. In nuclear cintigraphy, what we do is we use 10 microliter of technetium 99, okay, a radioactive dye which we basically put it inside the system, and we see the pathway of this technetium 99 from your nasolacrimal system. We catch it with the help of a gamma camera. So if everything is fine and still this technetium 99 is not draining through, this means that there is not a structural blockage, it is a functional blockage or a lacrimal system failure there. Okay. Then sometimes there can be just inflammation of the lacrimal sac. If there is an inflammation of the lacrimal sac, this situation is called acute dacryocystitis. If you can see, this is the acute dacryocystitis. Now remember, if you have the acute dacryocystitis, you do not have to basically treat the patient with a DCR, or you do not have to do a syringing and probing. If you try to do something invasive, it can basically cause a lot of hemorrhage and there can be superficial infection there. So whenever you are getting acute stage, in acute stage, you just give hot compresses to the patient, you give systemic antibiotics to the patient and analgesics to the patient. When it basically decreases, when it subsides, then you have to basically do a syringing and probing to see if there is any blockage, and if there is no blockage, and then this patient would resolve on its own. Okay, chalo. So the next question is about the chronic dacryocystitis. So chronic dacryocystitis is the chronic infection of the lacrimal sac. So there can be many risk factors for the chronic dacryocystitis like old age, poor socioeconomic status, poor hygiene. There can be a obstruction of the lower end of the nasolacrimal duct by some nasal disease, maybe some nasal polyps, or there can be a foreign body inside the nose. So these all can be the inflammation causes of the inflammation, chronic inflammation of your lacrimal sac. So whenever you have a chronic inflammation, it usually does not basically respond to your antibiotics. What you have to do is dacryocystorhinostomy. If even it is not working, or the patient is having a markedly shrunken sac, or there is a syphilis, leprosy, tuberculosis, atrophic rhinitis, or there is a fungal infection, it is better that you remove whole of the sac. If you remove whole of the sac, then this procedure is called dacryocystectomy. Okay, so dacryocystectomy, what are the indications? Too young of a patient, markedly shrunken sac, syphilis, leprosy, tuberculosis, atrophic rhinitis, and chronic infection. Okay, then this is a picture which I showed you earlier. This is the Bowman's probe, and this is the one which I use to basically open the puncta. Okay, this is called the punctum dilator. Okay, then there is another term which is called 3-snip procedure. So where I do this 3-snip procedure, sometimes there can be the stenosis of the puncta. Okay, there is a very small puncta which is not opening with your lacrimal probe as well as your punctum dilator. So what I do here is, I basically, if this is my puncta, I basically make a cut in the posterior part. So the posterior ampulla is basically opened. Okay, so this is called 3-snip procedure. They may ask you a question, 3-snip procedure is basically used in which condition? So 3-snip procedure is basically used in the patients who have got a punctal stenosis. Okay, then the next question they ask is about the dacryoadenitis. Now what is dacryoadenitis? Do not confuse a dacryoadenitis with a dacryocystitis. If there is a swelling of lacrimal gland, I call it dacryoadenitis. If there is a swelling of the lacrimal sac, I call it dacryocystitis. The main causes of dacryoadenitis are sometimes the ocular infections and the systemic infections as well. So what are the systemic infections which can cause the inflammation of lacrimal gland? The viral infections like mumps, infectious mononucleosis, measles, and influenza. What you have to do is do nothing, just give the antibiotics, hot fermentation, and the NSAIDs. The most of the times it resolves on itself. Then the next is Mycolic syndrome, which is seen in the leukemia, lymphosarcoma, or benign lymphoid hyperplasia. What happens in the Mycolic syndrome is there is enlargement of both your salivary glands, as well as lacrimal glands. Okay, this is basically called a Mycolic syndrome. Then we come to our next topic, which are the tumors of the lacrimal gland. So these tumors of the lacrimal gland, it can be the epithelial or non-epithelial tumors. Non-epithelial tumors like your non-Hodgkin's lymphoma, they are the most common type of the lacrimal gland tumors. The epithelial tumors, which is the most common, is your pleomorphic adenoma, which is there in basically seen in the young adults, and it is a benign tumor. Sometimes they ask you what is the proptosis that can happen with the lacrimal gland tumor. So as the lacrimal gland tumor is there superotemporally, it would basically cause the eyeball to go inferionasally. So you would have the swelling in the outer and the upper quadrant, I would say superotemporal quadrant, but if they ask the direction of the eye, it would be inferionasal. Okay, and it would have, if you do a histopathology, you would get pleomorphic myxomatous tissue in these patients. Then we come to the lacrimal gland carcinoma. So lacrimal gland carcinomas, the most important and the most common one, where you can have the painful mass, that is adenoid cystic carcinoma. There can be a pleomorphic adenocarcinoma, the mucoepidermoid carcinoma, or the squamous cell carcinoma as well. But the most common and the painful tumor is your adenoid cystic sarcoma. So what are the characteristics of these Adenoid cystic carcinomas, they are, as I told you, they are a painful mass, rapidly growing mass, and they are superotemporal, and this they cause the inferonasal dystopia of the eyeball. Very important is they can also cause the paresthesia because of the involvement of your lacrimal nerve. Then the last topic of the day is the Masquerade Syndrome. What is actually a Masquerade Syndrome? So sometimes the primary ocular lymphomas, even the foreign bodies or some intraocular tumors, they can basically present as an ocular pathology. So you would see that there is a conjunctivitis or there is a uveitis, but actually this is not a conjunctivitis or uveitis. It is something which is very dangerous, like some carcinomas, conjunctival carcinomas, or primary vitreoretinal lymphomas are there, which are masquerading as the inflammatory disorder. These are under the category of masquerade syndromes. Okay, so these are some most important points regarding the lacrimal gland and the lacrimal drainage disorders. If you have any doubt in any of the question, you can basically ask it in the comment section, and we would be coming back with a lot of important topics for you in this channel, that is the Let's Crack NEET PG channel. Subscribe for this channel with